purpose of this module is to introduce you to the CHSE Examination. That's the Certified Healthcare Simulation Educator Examination. This is an optional module because not all of you are going to want to take the exam, but because it is important to quite a few of you professionally, because it's a real credential, just like your certificate or a master's degree or anything like that would be. We wanted to make sure that you knew about it and talk a little bit about the content, and you can see where some of the overlap is between what content you've had in our certificate program and what is covered on the examination. The certificate program certainly is not a preparatory program for the examination, so there are quite a number of topics on the examination that are not covered in the certificate, but quite a bit of it is, as you'll see in a moment. Most of what you're going to see here is taken from the reference you see here, the review manual for Certified Healthcare Simulation Educator Exam by Linda Wilson and Ruth Whitman Price. It's an excellent book. If you're planning on taking this test, that's the book to get. It's very thorough, goes through each section with sample questions to help prepare you for this examination. There's also some material at the website provided here, and there's also the CHSE Examination Blueprint document, which is available on our website as well as at the website below. So to be eligible for this exam, you have to have a Bachelor of Arts or Bachelor of Science degree. You have to have at least 2 years experience in healthcare medical simulation. You have to have been active in the healthcare medical simulation field in the previous 2 years. So if you have 2 years of experience but it's not recent, you need to get current before you can even sit for the exam. But in all likelihood, if you're listening to this module, you're a student in the HMSC program, you're going to be qualified to take this exam. So in all likelihood, you're prepared to take it. The form of the exam, there's 2 versions that we know of. There could be more later, and the version that you get is actually selected at random, so you won't know. You can take the exam at an official exam center. Instructions are at the website. However, if you're military, and quite a few of you are, you can take it locally. So at your local command, they have a mechanism for somebody to proctor your exam, and you can sit for it locally. And details about all this is available at the website. And you probably have questions about the form of the exam. It's 115 multiple choice questions with 4 choices, A through D. And 15 of the 100 are what they call beta questions, which means they're being tested for future versions of the exam. And so therefore they are not scored. And naturally you won't know which 15 those are, so you need to be prepared for all 115. The cut score to pass the exam is not published. It's not a fixed number. It's determined by an algorithm. But you should probably expect that a score of about 75% is likely to be a pass. So you need to get 1 out of every 4 questions right. Now, as to the content, that'll be the rest of this module. There are 4 subject domains that are the focus of the exam. The first is professional values and capabilities. That's about 18% of the exam. Domain 2 is healthcare and simulation knowledge and principles. That's 28% of the exam. The biggest part is 3 educational principles applied to simulation. That's 40%. And then domain 4 is simulation resources and environments, which is only 14%. You'll see when we get into the topics, there's crosstalk between some of the different sections, so it's not like these are very clean, distinct areas. But really all you want from this is to know what do I need to study, what do I need to know more about. So, Domain 1, professional values and capabilities. It starts off with questions on leadership, on whether or not you have a vision for the future of simulation, and can you take steps to act on that vision. So they ask questions about management issues that relate to you being a change agent. How do you cause your organization to change? You'll be comfortable with all of these questions. There's a lot of this material in the course you're taking right now, in the capstone course that you're taking right now. Then there's a whole section on advocating for simulation. This is really an important part of this because a lot of the organizations that you'll find yourself in, if you're not in one right now, might not really know what simulation can do for them. They can't really develop a strategy of their own, and they really need people like you to develop that for them. So can you develop a fact-based argument advocating for the use of simulation within the context of your organization? Do you know when simulation is appropriate, when it isn't appropriate, how much is appropriate? Do you know when to tell when it's working and when it isn't? And to be honest about that, and to give objective measures, those sorts of topics. Then it goes into learning style. You'll see these are the topics you see on this page are come up a little bit later in some of the other sections, so this is one of those areas. So learning styles, whether your learners are visual, spatial, oral, kinesthetic, knowing how to identify age, cultural, gender differences in learning styles, those sorts of things, to make sure that your simulation environments are not biased towards one versus another. Then going into expertise models and how do you fit educational material to the level of the learner. And then finally, ethical, legal, and regulatory issues that'll have to do with IRB, collecting data, handling PII, dealing with evaluations, those sorts of things. Domain 2 is healthcare and simulation knowledge and principles. That starts with fundamentals of simulation-based learning. So how do you handle groups of learners, dealing with after-action review and feedback and performance measurement. Has a section on deliberate practice, team training, not just training teams, but how members of teams within a team training context learn from each other. Experiential learning, fidelity issues. Remember, there's multiple different types of fidelity. Physical fidelity, how close it appears to be, or often called perceptual fidelity, how close it appears to be the real thing. Task fidelity, how close is doing it in the simulator to doing it in the real world. And lastly, psychological fidelity, how close does the trainee mentally feel like the task in the simulator is like the real task. Then the use of moulage in simulation. So how is it actually done? When is it appropriate? The use of mannequins, whether they're instrumented or not, and how those should be used, possibly in concert with simulation products, whether the simulation products are embedded with the mannequins or whether they're tasks that are acted alongside. Standardized patients is of course a big topic. How do you scope their use? How do you prepare for and execute a simulation event using standardized patients? And then how do you do evaluation and measurement? And then hybrid simulation. So this has to do with part task training, how to develop part task simulators, how to figure out how they should be used with full task simulators within a curriculum, etc. Live, virtual, and constructive, combinations of each of these. These are more topics for mainstream M&S, but are becoming more and more population in healthcare and medicine. And then lastly, virtual reality, which can be thought of as sort of a general purpose simulator or a repurposed simulation capability. When is it appropriate? When is it appropriate? How do you determine its limits and its strengths? Domain 3, educational principles applied to simulation. Start off with educational theories, the two big ones being behaviorism and constructivism. Remember, behaviorism has to do only with what's observable. Constructivism goes a little bit deeper into cognitive theories. Learning theories, experiential learning. Remember, scaffolding, very highly related to part task trainers as you build skills up in parts and then put them together. Social learning, so how your trainees will learn from each other in the context of your simulation events. Critical thinking and metacognition. How do students know what they know about what they know? Do students have a reasonable understanding of how much they know about the tasks that they're executing and how good they are at them? Motivation is a big deal in learning. How to maintain motivation, create a motivational environment where learners will excel. Then curriculum development. So how do you identify what the appropriate goals are for your curriculum? How do you write learning objectives? That's a hard problem that everybody struggles with. And then linking your assessments to those learning objectives. That's a common mistake where educators will write learning objectives and then create assessments that aren't linked to them. They always must be linked to them. Planning simulation of activities within a curriculum. So how do you develop a needs assessment to determine if you need simulation and where you need simulation? How do you develop the scenarios within the simulation that meet your learning objectives? And of course, then you have to link those two together. Then debriefing and after action review. Know the difference between structured debriefing, unstructured debriefing, and interviews and questionnaires. Whether you're doing your AAR in a group or whether you're doing it individually, and the positives and negatives of both of those. And then, of course, there are the unique issues of debriefing and AAR as they apply to standardized patient events. Evaluation, extremely important area, sure to be tested, knowing what to measure. To what degree must the student perform? So how do you set the minimum benchmark in your objective learning measure? Know the difference between formative and summative evaluation. That will almost certainly be on your exam. Peer evaluation, self-evaluation. What are those? Where are they appropriate? And how should they be used? Research issues pertaining to learning and simulation. And you all know about that because that's really what you're doing in our class together right now. Domain 4, simulation resources and environments. So know about management issues. This has to do with running a facility, running a laboratory, how to maintain operations and scheduling, especially having to do with your limited availability assets, your simulators that have to be scheduled. How do you manage your facility? How do you manage and plan for your upgrades? When do you replace your equipment? When do you retire equipment? How do you set up a facility in the first place? Then accreditation of labs and programs. So knowing what can be accredited, what are the industry standards that are used in accreditation in labs and programs. So I have set up a small little 10-question quiz that's available on our website. This is just a virtually random sampling taken from the Wilson and Whitman Price text, which contains a full practice exam. Again, that's why I recommend that you get the text if you are planning on taking this exam. Certainly our intent here is not to replace that text, but to just give you an idea of what the exam is all about and what the exam questions are all about. So you can get a better idea of whether you think you want to take the exam and what it's going to take for you to properly prepare for it. So yeah, if you think you want to take the exam, we highly recommend the text or some other text that you can find, plus the published material that's available on the CHSE exam website.